My name's Simon Thompson. I'm an orthopaedic knee surgeon. I have practices in London and across Surrey. Reconstruction of the ACL isn't always 100% necessary. If you have instability of your knee and an unstable examination and an MRI scan prove an ACL rupture, then surgery can be an option. Very rarely the ACL can actually heal, and that's why I re-examine patients on a regular basis prior to their operation. This can occur, and if it does, this does not require an operation. The majority of unstable knees, however, will probably require reconstructive surgery. The benefits of having an anterior cruciate ligament reconstruction are protection of the knee. I published some very important papers back in 2015 and 2017, which proved that having an ACL reconstruction actually protects the knee against degenerative change, showing excellent outcomes at 20 years post-surgery. This is clear in the medical literature, as the ACL really protects the meniscus, which are the shock-absorbing aspects of the knee, which then protects the articular cartilage. So ACL reconstruction should be of benefit to patients that have instability in their knee. Any type of surgical procedure obviously carries risks and disadvantages, and these are explained at the time of consent process, specific to the operation and specific to that type of surgery. The major risk in any type of surgery is failure and requirements for further surgery. The failure rates for ACL reconstruction are normally pretty well tolerated and are normally quite low, and I published these in some award-winning papers in 2015 and 2017. ACL reconstruction is normally performed through minimally invasive techniques and arthroscopic knee surgery. The procedure is normally day case. It takes around an hour to an hour and a half and is very well tolerated by the majority of patients. The rehab process is pretty clear after surgery. The rehabilitation following ACL reconstruction is well documented in the medical literature. For contact sport and return to contact sport, this is dependent really on return to play testing, which is dependent on how far the patient is through the rehab process and if the rehabilitation has been followed adequately. It's normally a well-tolerated rehabilitation protocol, and at the time of the procedure, I provide my patients with a dedicated rehab program specifically for their operation. I liaise with their physio on a regular basis to make sure and they get the optimum outcome. Return to sporting activity is normally completely dependent on whether the patient fulfills return to play activity. This is a specific type of testing which can be done in specialized centers, or if your physiotherapist has the ability to do these. That's the majority of patients will undergo this. Certainly elite level athletes will have RTP, which is return to play testing. And I now advise all of my patients undergoing ACL reconstruction, if they wish to return to contact sport safely, that they undergo this type of testing.